Welcome back to American Sunrise. I'm Dr. G. Thanks again for joining us. Time now for today's health news. It is sponsored by the Wellness Company. And under the microscope today, new breakthroughs in combating cancer. This is really exciting. I came across this yesterday, actually on Instagram, looked up the study, sent it into the producers. The Liverpool Hospital has unveiled a new state-of-the-art medical imaging suite, first of its kind in New South Wales. This facility combines MRI, CT, and angiography, and all of this technology is in one location. This allows doctors to diagnose and then go in and treat the cancer without moving them and without chemo and without radiation. Health officials say the upgrade will improve safety, speed up care, and support more complex life-saving procedures for patients across southwestern Sydney. What the process is, they have a needle, they go in, they put a chemical compound inside the tumor that actually causes the tumor to disintegrate. Literally, it freezes it and causes it. And they, right before their eyes, in front of the imaging, they can watch the tumor begin to disappear. And usually no follow-up chemo or radiation is necessary. Let's bring in the Chief Scientific Officer for the Wellness Company, Dr. Peter McCullough. Dr. McCullough, this is really exciting technology, and I believe, and you and I were discussing on the break, we are really at the cusp of many cures and treatments and even pre-treatments, which we're going to get into with the Wellness Company, for cancer. And it couldn't come at a better time after a combination of the vaccine and, of course, the virus or viruses have, it looks like, led to higher cancer rates. They're now saying 1 in 3 people will get cancer, but we may have a solution.
You know, so true. We're hearing so much from our colleagues in oncology. I'm at the Battle for Science conference hosted by Lighthouse TV just outside Amsterdam in the Netherlands, and we have oncologists here. We believe that pandemic years will increase cancers of almost all sorts. You know, the current data from the National Center for Cancer in the United States is just from 2022 data. So we imagine when 2023 and those roll in, the numbers will go up. The technology you described is very exciting. Remember, so many solid organ cancers like lung, kidney, pancreas, they're potentially curable if caught early, but we rely on advanced imaging to detect them. It's so good to see this coming together. Of course, now there are multiple trials testing, widely available ivermectin and mebendazole in combination, adding on to conventional treatments to reduce the recurrence and potentially cure cancer.
Yeah, it really is exciting. And this one in particular, I believe, was effective on liver, kidney, and lung cancer, as you mentioned. But very exciting stuff happening also in terms of prevention. Talk to us about that, Dr. McCullough.
A lot of people think about preventing heart disease through diet and exercise. People don't think about how to prevent cancer. And it turns out there are lifestyle as well as, other things we can do, dietary for sure. And at the Wellness Company, we've innovated, and Dr. Kelly Victory, who is a cancer survivor herself, has helped assemble, we think, the best of all the medicinal and culinary botanicals into a system. It's called SHIELD, and it involves 3 soft gel capsules a day and then 1 drink per day. And it's designed for people at risk for cancer or those with cancer that are working to try to lower their chances of recurrence.
And can you tell us metabolically what this does?
What's important here is to understand our body has a cancer surveillance system. One of the most prominent ones is called P53. There are ways through botanicals to increase the activity of these cancer surveillance systems. So when a neoplastic cell arises, the human body turns it off or snuffs it out before it develops into a metastasis.
And in a recent post on Substack, you told us more about this. You said nature first, drugs last when it comes to cancer prevention. Explain.
Well, people have been interested in whether or not they can take a drug. So for instance, and it's limited. So let me say, aspirin to help prevent colon cancer. It's still debatable. People have looked at aromatase inhibitors, for instance, the prevention of breast cancer. But if we actually use diet as well as safe nutraceuticals, we can use those long-term over many, many years. So it would be these things first, And then if a cancer does arise, we use conventional surgery, chemotherapy, radiotherapy. But boy, wouldn't it be great to prevent cancer, certainly in each one of us, and lower the population burden? You pointed out, Dr. Gina, it's a huge number of us that are going to develop cancer.
Yeah, and you know, one of the things that I love about the wellness company and the thing that you do is you kind of combine all of the things that a lot of us are reading and know about. But literally, I have trays full of tinctures that I was having to do every single day. And the nice thing, for example, with Shield, it has things in it that I was already putting in to other things just to try to get them all in one day, and it became all consuming. This makes it easy. Things like turmeric, which we all know is really good, green tea extract, black cumin seed oil. These are components in the wellness company's new product, Shield, but you're not having to take them all in all these different ways. It kind of combines everything all in one fell swoop.
At the wellness company, you know, we haven't patented these either. So the ingredients are all there for people to follow. But what we've done is put them in single products that have multiple ingredients. It becomes far more cost effective, it becomes easier to take. And we do believe these in combination, they have a synergistic effect. So while each individual one can do a little, when we combine 6 to 8, in a single product, we do much better. These principles work for cancer prevention as well as detoxification.
And the mushrooms, of course, we're reading so much about turkey tail and other mushrooms, but you're right. When you use them all together, it matters a lot. So if you can only get in a few of the different supplements in a day, it may not be as effective as with Shield, where it puts them all at one moment.
So true. And, just a matter of getting in the habit of doing this every day. I think, most of us now, through the pandemic years are taking more supplements than we did before the pandemic years. And it's a matter of sticking with it, understanding it's a long-term approach, but boy, the benefits can be so big.
Yeah. What are you seeing? What are you hearing from your customers and your patients?
Well, for sure, the population has moved to higher doses of vitamin D. This is important. Vitamin D, not only for raising the body's immune system, but also reducing the risk of metabolic bone disease, heart disease, neurodegenerative diseases. Many are taking immune boosters that include zinc and vitamin C, oregano, echinacea, elderberry, because there are data to support we can actually reduce the risk of getting recurrent viral infections. And so, I think all of us ought to be having, in addition to our diet and exercise, a supplement strategy to stay healthy.
Yeah. Isn't it amazing? These are all things God had out there before Rockefeller and his oil got involved in our medicine system. Dr. Peter McCullough, thank you for bringing this all back, all these natural cures. We appreciate it.
Thank you.
All right.